came into practice nursing quite by mistake. After qualifying, I'd worked in urgent care, accident and emergency, all up and down the UK. My husband was in the armed forces, so we moved about a lot, which was great because I got lots of experience in lots of different settings. But when the family came along and my husband was away, 12-hour shifts and nights, I just couldn't manage that anymore. I went to see a friend who'd started practice nursing who said, why don't you just write to a couple of GP surgeries? So I did. I got the job. I had absolutely no experience, but I tried it and I loved it. It did fit in with family life better. It made it manageable. I did have to do some additional qualifications in general practice. The general nursing skills are still there. You know how to monitor and examine a patient. But there's additional skills as well. Childhood immunisations, vaccinations, which is all new. Cytology, which is a big part of general practice, and then the chronic disease management diplomas. So each chronic disease, there are qualifications you can do, and then that laid on to doing prescribing and clinical assessment and minor illness. And these are the kind of things that are the bread and butter of general practice. We do all day, every day. In January this year, I completed my Masters in Advanced Clinical Practice with a distinction at Lincoln University, which is a really big personal achievement. And it also makes me quite proud of the journey I've come on. I am really, really proud to be a nurse. I'm really passionate about nursing. I don't want to be a doctor, I want to be a nurse with additional skills. And I want to be able to manage my patient's journey from start to finish completely. On a typical day, I will start by doing what we call our open access clinic. And this is on-the-day clinic for anybody who wants to be seen urgently. Mrs. Smith. Hi. Hello. Do you want to come in? We're just in the first door there, okay. They can come to the clinic as long as it's a new problem, and that can be from children, babies, right the way up to the elderly with just about anything, from an injury to an illness to concerns to mental health problems. We don't know what's booked into the waiting room, and I'll work with usually some junior doctors or GPs, and we will just call the patients in turn from the waiting room. This clinic typically lasts till mid-morning, and I'll go on to do some telephone triage then, usually about 8 telephone appointment slots. Some of them can be managed over the phone, some of them will need an appointment, but it won't be an urgent appointment and we can fit them in over the next week or so. And I'll go through some tasks on the computer, look at blood results, there'll be letters, x-rays, discharge letters that need signing and filing, and patients that need informing. You've sent them away for this test and they're sat waiting, so it's nice to let them know the outcomes. In the afternoon, I have again a nice mix. I have some that have been pre-booked in advance, so they may have been triaged by myself or someone else earlier in the week. Or I do still see some chronic disease management because respiratory illness is a little bit of a passion of mine. So certainly the asthmatic and COPD patients I would probably see. Some afternoons I go and do home visits, and that can be for patients who are housebound but have got really complex needs. So they might have dementia, they might have chronic health conditions, and I will go out and do a holistic care review and a medication review for them as well. I'm absolutely passionate about general practice for nurses. It is such a fantastic career. It gives you a really high level of autonomy. You're working with a team, but you're dealing with patients and managing their journey from start to finish. And you get to know them. You get to know the wife, the husband, the children, the grandparents, and that is really enjoyable. And I'm also passionate about nurturing new nurses and getting them to come into general practice. There are amazing opportunities. You could specialise in women's health, in sexual health, you could specialise in a chronic disease, you could specialise in minor illness, and there are so many practices out there that have got opportunities for training and for nurses. Anyone interested in coming into general practice would be welcome. They could contact their CCG, and most of the CCGs now have a lead nurse for general practice, and they would be able to advise them. There are also now degree courses, general practice, BSc, that will help give them all of those core skills and upskill them quickly, and the practice can support them while that's happening. Another way would just be to send your CV out to different GP surgeries. If you're enthusiastic and keen, that will come across, and that's all we want, is enthusiastic, keen team players, and we can help nurture your talent.